So the ones who need it the most are going to be the same ones who we recommended at the beginning of the vaccine initiative a couple of years ago, and that's going to be people who are either healthcare workers and social workers, people who have chronic illnesses, particularly if they involve the lungs, cardiac disease, lung disease, diabetes, high blood pressure, which are risk factors, or obesity, risk factors for severe COVID. People over the age of 65 have a risk factor for severe COVID just by virtue of the age. And then immunocompromised individuals, anybody who is taking a medication to suppress their immune system for either for transplant or for rheumatologic disorders and things like that. What was very interesting, however, is that the CDC yesterday, in their rollout and recommendation for these vaccines, said that pretty much anybody 6 months of age or older is eligible for those vaccines. So unlike prior rollouts of vaccines, they are not going to set up tiers where we'll only vaccinate the high-risk people first, and then the less risk people, and then finally everybody else. They are allowing anybody who wants to get it to receive that vaccine at this point. It sure seems that we are going to be chasing the variants, as we do already with the flu, chasing new flu strains that come out each year. It appears that we'll probably be doing that every time there's a major change in the variants. The current vaccine is different from the vaccine that they just pulled off the shelves yesterday, the bivalent booster vaccine. These two new vaccines that are coming out are what are called monovalent. So they're only going to cover one virus. They will not cover all the old variants that we saw before Omicron. They're only going to cover Omicron and, to some degree, the newer variants that are circulating. If there comes a time where there's a new variant that's substantially different from Omicron, then we'll probably hear about another vaccine that is going to be targeted against that new variant at that time. So I don't know how long these vaccines that are coming out will be released for, how long they'll be effective. We do know, however, that they do cover the strains that we're seeing circulating, leading to the current uptick in cases and hospitalizations from COVID.